What is the correct dosage of amisulpride? If you are curious about the correct dosage of amisulpride, you are not alone. This medication plays a significant role in treating schizophrenia, and understanding its dosage can be essential for effective management. Amisulpride is an antipsychotic medication that targets both positive symptoms, like delusions and hallucinations, and negative symptoms, such as emotional withdrawal and blunted affect. For acute psychotic episodes in schizophrenia, the recommended oral dosage typically ranges from 400 mg to 800 mg per day. In certain cases, depending on how a patient responds and the severity of symptoms, the dosage may be increased up to 1200 mg per day. However, it is important to note that doses above 1200 mg have not been studied extensively for safety and are not recommended. Interestingly, higher doses above 800 mg have not shown better effectiveness and may increase the risk of side effects. This makes careful dose adjustment based on clinical response very important. For patients who experience predominantly negative symptoms of schizophrenia, lower doses of amisulpride are often used. These doses typically range from 50 mg to 300 mg per day, with an optimal dose around 100 mg per day. This approach helps improve negative symptoms while avoiding unnecessary exposure to higher doses that are more suited for controlling acute positive symptoms. When it comes to maintenance treatment after an acute episode, the dosing is usually tailored to the individual. This often falls within the range of 400 mg to 600 mg per day to maintain symptom control and prevent relapse. Amisulpride's flexibility in dosage is important because symptoms of schizophrenia and patient responses can vary widely. This medication is also noted for having a relatively lower risk of extrapyramidal symptoms, which are motor side effects that can occur with some antipsychotics. This characteristic supports its use in both acute and long-term management of schizophrenia. To summarize, for acute schizophrenia exacerbations, the dosage is generally 400 to 800 mg per day, with the possibility of increasing to 1200 mg if necessary. For predominantly negative symptoms, the dosage is usually between 50 and 300 mg per day. Maintenance therapy is often individualized, typically falling within the range of 400 to 600 mg per day. Always remember that dose adjustments should be guided by clinical response and tolerability. The goal is to use the minimum effective dose to manage symptoms while minimizing side effects. This approach aligns with the neurotransmitter effects of amisulpride, which selectively modulates dopamine receptors involved in schizophrenia symptomatology.